the recording. Actually, this is Greg D'Alessandro. I'll be doing the administrative instructions. Just give me a moment to share my screen.
My apologies, Greg.
All right. Good morning, good afternoon, good evening, colleagues. My name is Greg D'Alessandro from the U.S. Department of State. I'll be stepping in for my colleague, Brian Morales, this morning. Welcome to the Global Coalition to Address Synthetic Drugs Threats Sub-Working Group 3.2 in the month of January 2024, engaging people with substance use and substance use disorders. Now, I have some administrative announcements to share, so let's just get started. First, I want to discuss three sectors and the plans for the upcoming months. The first sector being civil society engagement. On February 1st, we will have the Global Coalition Civil Society Forum hosted by the Vienna NGO Committee in collaboration with the New York NGO Committee. This will take place through two sessions, one from 9 to 11 a.m. and the other from 4 to 6 p.m. Central European Time. Coalition governments are encouraged to attend those sessions and to hear from civil society organizations. Invitations will be sent out to you all shortly to attend that session, and we will post a recording of the event on our website. Additionally, we are now starting our Global Coalition national dialogues between governments and civil society organizations. Yesterday, January 24th, the United States hosted the U.S. National Dialogue with Civil Society Organizations. It was hosted by the White House Office of National Drug Control Policy. It was an excellent event and a good opportunity for civil society to share its views and recommendations. The event was recorded and will be posted on the Global Coalition website. If you visit the website this morning, you will notice that there is a new section on civil society, so we can start engaging better with civil society. And so the plan we discussed last month is outlined there. We also invite all of you and colleagues and your governments to host your own meetings with civil society organizations to discuss the Global Coalition and synthetic drug threats. Finally, the Vienna NGO Committee will also collect additional feedback and recommendations from civil society, and we will make that information available to you through our website in the coming months. So that was the first section on civil society. The next sector I would like to introduce is university engagement. ICUDDR is the International Consortium of Universities for Drug Demand Reduction. This is an NGO that was established in 2016 with funding from INL and currently has 422 universities from around the world that participate. This organization will convene universities to reflect on the challenges of synthetic drugs and provide us with research, policy ideas, and programming recommendations. The discussions will focus on all three working group themes, even though their focus traditionally is drug demand reduction. And the activities that they will pursue are as follows. First, they will host regional focus group virtual meetings during the months of February and March in 6 regions: Africa, Asia Pacific, Europe, Latin America, Caribbean, Middle East, US, and Canada. The goal will be to develop recommendations and to prepare a report for all of you and for governments. Next, they will conduct 6 regional virtual meetings with universities and governments during the months of April to June. And this will be to incorporate the views from governments, have a dialogue, and then again develop a report for coalition members. And finally, in June, they will conduct an inventory of university initiatives that can support the Global Coalition's work and document them on the coalition website. The third sector that I want to discuss is the private sector. And next month, we will present a plan of engagement with to you all. We will be finalizing it this month and sharing it with our co-chairs. And then we'll be ready to present it at next month's sub-working group session. Now I want to provide some additional information about our website. We have a new communication feature that is going to be active soon, which will allow participants to share content similar to what you would find on LinkedIn, Facebook, or YouTube. It will go live in February, but will require accounts to be activated participants. For you to be able to post something on the website where you will be able to log in and then be able to post under your name. In the coming weeks, you will all receive an email that will invite you to create an account and post so you can post content. So please look, please register once you receive it. It will be sent to the same email you used to register for the coalition. We welcome you to share your experiences, your news, but most importantly, your recommendations that your country can offer for the coalitions. It will be an important tool to be consulting regularly to be able to construct the recommendations. Now, here's a screenshot of what that wall or that in Facebook-like social media aspect might look like, which has a text box where you can post content on. You can add images to it. You can have this wall to monitor what others have said and to comment on their posts. So finally, next steps. I want to end the discussion discussing a new section to our website, which is forthcoming, which is called the work we've been doing over this point forward. This is an important time for the coalition's work, and it is important that we all are on the same page in terms of where we're going. Between December and January, we invited international organizations to share with us what we are calling initiatives. They can be programs, actions, or policies. We have received now over 100 working groups. Our team has been reviewing and preparing them to be posted on the coalition website. That will take place during the months of January and February. What do these initiatives look like? If you take description and documentation, any accomplishments that have taken place to date, if it is an existing initiative, although in many cases they will be new, program activities and the steps that will be followed to execute them, outcomes at the global and national levels, the names of the countries that are currently participating, and the point of contact should you be interested to add yourself and your country to these initiatives. During the month of February and March, we will begin inviting all of you colleagues to begin identifying initiatives of interest and to express interest to the international organization POCs on that menu link. The email address is provided for each individual initiative. Now, during March, many of you will be attending the Commission on Narcotics, Drug in Vienna. We look forward to opportunities to further engagement and discussion. Between April and July, there it is, we will begin the implementation phase of the global initiatives. This will not be concluding them, but just the beginning of them, and they will continue for several years. Now, I want to conclude today by discussing recommendations. We've reviewed all the topics from the monthly coalition meetings from November to February, and we are creating a draft list of recommendations which are being shared with co-chairs during the month of February and posted to the website in March, in February, in draft form. March 6th and 7th, there will be 3 working group meetings where sub-working groups co-chairs will report to working group co-chairs the progress that has been made over the past months, and also presenting these for discussions, and all of you can also comment and weigh in at that time. The recommendations will be posted on the website, and we will continue to welcome further input and recommendations from all of you through the mechanism I previously shared. Let me just make sure that's there. Okay. We previously shared the posting mechanism that will be uploaded to our website. Now, I know that was a lot of administrative announcements. I apologize for taking so much of your time. I will turn it over to our co-chairs for today, Dr. Nicholas Prise and Dr. Yoro Kutipe. My apologies if I mispronounced that.
Bonjour à tous. Merci beaucoup, Greg, pour cette présentation très utile. Merci.
Good morning, everyone, and thank you, Greg, for this wonderful presentation. Hi, Yuri. It's a pleasure to see all of you in this beginning of the year, and I hope 2024 will be great for all of you. We are here to talk about the recommendations that Greg presented in this sub-working group. We do have 4 presentations today with several initiatives aimed at improving the care for people who are having difficulty with abuse of substances. We will start with an initiative by Kalina Martinez. She's an associate professor at the University of Aguascalientes in Mexico. And I think it's a recorded video, so please let's listen to Kalina.
Hola, soy Kalina Martinez.
Hello, my name is Kalina Martinez, a researcher of the Autonomous University of Aguascalientes, and part of a team that developed the brief intervention program for adolescents who use alcohol and other drugs, known by its acronym PIBA. This program was published. Its first iteration was published in 2005, and this program seeks to help teenagers reduce their patterns of consumption and to reduce the negative consequences stemming from their substance abuse. PIBA is a program designed for teenagers between 12 and 18 years of age who are currently studying and who have experienced adverse consequences stemming from their substance use over the last 6 months and that have not yet shown any symptoms of addiction or dependence. The program comprises 5 serialized phases, each one of which has components which you can see up on the screen. These aspects provide characteristics of evidence-based interventions using mostly tools that have been validated, such as the POSIT questionnaire and techniques and approaches like motivational interviewing. Stage 4 is the central part of the program, focused on six treatment sessions to address critical topics such as adolescent communication with those around them, decision-making processes with a stress on reflecting on pros and cons, for them to discuss risk situations, taking into account individualized risk factors and the implementation of plans of action and how to set life goals. The final part of the program includes follow-up with at least one session 6 months after concluding the intervention in order to assess change and to keep that change up. There have been various studies conducted over the last 20 years in which the effectiveness of the programs have been evaluated in different populations of adolescents, and what we've found are changes in patterns of consumption and a drop in the related consequences at the end of the intervention as well as in the aftermath. Now, knowledge transfer studies have been conducted to ensure the adoption of the program, the uptake of the program in different institutions as well as different countries. And we have managed to make this program flexible and to ensure that the results are cost effective. Nowadays, PIBA can be carried out online or virtually with the resources made available for those receiving the services for therapists and adolescents alike. The digital PIBA package and its methodology have allowed us to transcend geographic borders, offering training, oversight, technical assistance to professionals who offer clinical and psychosocial services in 6 Latin American countries. The PIBA platform is innovative because it offers therapists the necessary resources for them to implement these interventions. And it also offers tailored reports on adolescents' activities and actions in PDF files. Data visualization options include stats for the day, week, month, making it possible to make comparisons and to better analyze trends. Therapists can monitor and follow up on their cases through specific behavioral measurements. We invite you to take part in PIBA training. We're at your service and available throughout the year, and we think that this program can be used in your professional practice, especially for the adolescents with whom you work can benefit from this and ultimately change their behavior. Thank you very much for your attention.
Thank you very much, Dr. Kalina Martinez, for this presentation. It's very operational, and through its dissemination, it's already demonstrated its success in 6 Spanish-speaking countries. And it was a very clear presentation, so thank you so much. Now we will continue with the next presentation, and then we have a discussion after all of the presentations are completed. So you all know Anja Busse, who works, who's a program officer at the UNODC. Anja, thank you so much for joining us for your presentation. You're going to talk about a program that's called TreatNet Family, and the floor is now yours. Thank you.
Wonderful. Thank you so much. And I'm sorry you have to bear with me again. I hope you find this interesting. I want to present to you very quickly a program of UNODC on elements of family therapy called TreatNet Family, which is really for the treatment of adolescents with substance use disorders. And as you may know, family therapy is among the WHO recommended treatments for substance use disorders, especially for cannabis and stimulant use related disorders. And also based on this recent evidence review, it's among the well-established interventions for adolescent substance use disorder treatment. That's what guided us in this direction. I think what's also really good news is that the effect of family therapy can not only be on drug use reductions, for example, but there have been positive outcomes demonstrated in many areas, for example, also with a view to delinquency reduction among adolescents. And so there are a lot of evidence-based family therapy programs. Many of them, though, are packaged and copyrighted. But the developers of these programs have very generously shared their wisdom with us. And we could, based on a common elements approach across these programs, develop TreatNet Family, which is now in the public domain and is a relatively short 5-day, maybe 4 to 5 days training program on elements of family therapy that was developed especially with a view to the needs of resource-limited settings. So TreatNet Family, the package consists now not only of the slides, but there's also a practitioner manual, a trainer manual, and a study protocol to evaluate it when taken to a new setting. And one place where we have initially evaluated was in Indonesia in 2019-2020. We did an implementation study, and I show you some of the results in a moment. But before, I just wanted to give you an impression of what taking this family therapy to the real world looked like. You can see here that a lot of the sessions actually took place at the homes of the families, because many perceived that, for example, as less stigmatizing, or they had other than that challenges to come to the treatment services. So that's how it was implemented with a real life workforce also. And what we could demonstrate is that the adolescents who participated in these TreatNet Family sessions showed a significant reduction in substance use related problems, and also had less mental health problems. A report is available on our website, and we have also published the results in scientific journals. And what is also really, really good news in terms of scalability, that after this initial pilot in Indonesia, for example, TreatNet Family has been scaled up, and Indonesia made it a national program. So it's part of the routine training and service delivery now, for example, in Indonesia. But, and here you see kind of that TreatNet Family has already been translated in many languages and still counting. And I think by now we have had TreatNet Family trainings in 33 countries, basically in all regions of the world, in online and in on-site formats. And it's really available for you. And if you're interested in it, and I will just keep this slide up for a moment. So if you want to, you can do a screenshot, or you can take out your phones and make a photo of this QR code. Behind the QR code, all the training materials, the scientific evaluations of it, and all what we have and about TreatNet Family is available to you. And with that, thank you very much. And more questions, you know how to find me. Thank you.
Merci beaucoup, Anja. C'était très clair.
Great. This was very clear, and this really complements the previous presentation that we heard. In fact, it broadens the mechanism that helps families finding themselves in this type of situation, which is very important. Thank you, because it's also something that's up and running, it's operational, it's been tried and tested on several occasions, and it certainly thus can be disseminated at larger scale. And I hope that we will talk about it more during the discussion. So thank you again. Now we have our third presentation. So through the first two presentations, we heard about how important it is to promote programs and prevention mechanisms that are quality-based. And so now we have the great pleasure of hearing live from Rita Notarandrea and Rodrigo Portilla. And they're going to talk about the manner in which quality can be improved for treatment programs. And this is through a global quality assurance initiative in order to provide care for people who are experiencing substance use problems. Thank you, and the floor is now yours.
Thank you very much. If the slide could be put up, please.
And Bill, do we have an arrangement to show the slides for Rita?
Yes, I believe it was Elijah or Cyril that were.
I was not, my apologies, I was not expecting to do that because I'm monitoring the interpreters. But Bill, do we have the arrangement?
I do not know of that. Thank you. Let me do some checking real quick. Rita, can you try to share your slides? I do not have them.
Okay, I checked with Bruno. I know he had sent them in from INL. Let me see then if I could pull them up. I didn't have them ready. My apologies then.
No, my apologies. So we're a little disconnect over here. Sorry.
Si quieres la comparto yo la tengo.
Okay.
Rita, I have the slides. I could share them.
Okay, thank you, Rodrigo.
And I'm confirming that we can see the slides. Go ahead, please.
Thank you, Rodrigo.
Thank you. Good morning. I will whip through these. So we've wasted a few minutes trying to find the slides. So thank you for your patience. Next slide, please, Rodrigo. My presentation will be on the background, and some of you are very much aware of that background. 2 initiatives to support countries to improve quality, and then some conclusions and context. Next slide, please. In terms of reminding us of why is quality in drug treatment important. First of all, let's talk about quality. And according to the World Health Organization, is what we are doing having the desired intent? And that is the focus here. And then also WHO presented us with some criteria against which we can compare our services to ensure that there's quality. Next slide, please. There are international goals and agreements on ethical evidence-based practice in substance use disorders treatment, and I'm focusing on two. We have the Sustainable Development Goals that speak specifically to improving the quality of treatment systems and services. And we also have a resolution of 2016 that not only speaks about quality, but also references the international standards, which is the basis for my presentation today. Next slide, please. Why is substance use disorder treatment important? Because it is costly to countries, but it's also costly to individuals, their families, and communities. It can be successfully treated. It can be cost effective, but all of this is based on the fact that is the treatment of good quality and is it tailored to individual needs? And I can share with you that there have been sufficient number of life and recovery surveys that have taken place that have shown the very positive outcomes for individuals and their families when substance use disorders is treated. Next slide, please. There are two levels of quality, and I will speak to both in my presentation. There is quality in systems and quality in services, and both are interconnected. Next slide, please. At the system level, there are the international standards, and I spoke about them as per the UN resolution of 2016. Next slide, please. And the international standards speak to 5 system standards, and it's about multi-agency planning, needs assessment, so on and so forth. Also, the international standards speak to models of care. And one example on the screen is one country's self-assessment of where they fell in terms of these 5 standards and in terms of the system of care that they provided. Next slide, please. So that was at the system level. At the service level, many international organizations have come together to agree on a core set of standards. Next slide, please. And I wanted to mention those international organizations that came together for the key quality standards, and together they developed these standards. It is the European Union, the international standards from WHO and UNODC that I referenced, African Union, CCAD, as well as a number of toolkits and training that was done by UNODC, training in 14 countries. Next slide, please. All of that experience came together to form the key quality standards, which is what is used to assess services. So I spoke to system, now I'm speaking to services. Next slide, please. And this is an overview of the key quality standards. I'm certainly not going to speak to each one, but I draw your attention to the top level. And the top level speaks to the very criteria that WHO referenced, which had to do with the effectiveness and effective management, patient-centered, timely access, and health, safety, and human rights. Next slide, please. There are 2 initiatives that I will speak to briefly that will help us improve quality and align with the international standards and guidance that are out there. The 2 initiatives both support quality, and they are looking to create good quality treatment while at the same time good quality agencies to evaluate the good treatment. Both of these initiatives provide technical support to countries to improve the quality of the systems and services, as well as their quality assurance and evaluation efforts. Next slide, please. The first initiative is PCAT. It provides technical support to countries to plan a system of care. It is offered by and supported through projects with 3 international organizations, the Colombo Plan, OAS CCAD, and UNODC. Its purpose is to assess countries' adherence to and compliance with the international standards. And their approach, though it is standardized, though there are 13 steps to do this analysis, it is tailored to the country's interest. Next slide, please. There are three overarching steps to this that have been applied to different countries. One is agreeing and creating a team. The next one is a system self-assessment resulting in an action plan. And the third is how do we maintain quality assurance in our systems and services. The next slide indicates the details associated with those three levels. And the thing I will stress here is it's not a linear process. It is dependent on the country's interest, but the result is an action plan for system and services in terms of improving their quality that aligns with the international standards and guidance. Next slide, please. The next initiative is ICQ. And ICQ is a global organization that was set up to provide a hub for organizations to come together and to talk about substance use and substance use quality assurance. It was created to work with three stakeholder groups. Those are QA organizations, the treatment providers themselves, as well as the patients, family, and caregivers. It does this work through peer-led mechanisms, through training on quality, and through technical support to assist the quality assurance agencies, for example, accreditation bodies, inspectors, regulators, to obtain the International Quality Seal Award. And as I speak about the Quality Seal Award, there's actually a document that supports the implementation and the application for that quality seal. So there's training support to assist QA organizations to obtain this quality seal. Next slide, please.
And Rita, the interpreter is asking you to slow down a little bit. Thank you so much.
No problem. So ICQ works in partnership, I did mention, with key stakeholders, and those partnerships have to do with the QA organizations, the substance use service providers, the international agencies with responsibility for helping countries, as well as patient, family, and caregiver advisory groups. And the key message here is that technical assistance is there to help improve and sustain quality assurance in countries through both those initiatives that I have referenced, ICQ and PCAT. Next slide, please. So both initiatives are there to help countries embed quality and quality assurance in their systems and services. And this is done through an assessment of the system and the services against the international standards. It's done through partnership with countries to do the assessment. It is done through partnerships with the country's QA agencies to obtain the quality seal. And through these efforts, really embed a culture of continuous quality improvement in both services and systems. Next slide, please. And the final concluding slide has to do with, we can have the best standards in the world, but unless they're implemented, it will not improve the quality. And so implementation is critical, and support is available through ICQ and PCAT. Both initiatives promote the international standards and the guidance that is out there. Both help us recognize good practice, challenge poor practice, and encourage continuous improvement. And together they provide technical support and training to interested countries and organizations to improve the quality in substance use treatment. So my last message to all of us is let's make a difference together, and let's promote quality in substance use systems and services. Thank you so much. On the last slide are really contact information, how to get in touch with me as it pertains to quality improvement and as it pertains to PCAT. Thank you so much.
Merci beaucoup à vous, Rita. Merci aussi à
Thank you
Rodrigo.
very much, Rita. Thank you, Rodrigo, as well, for the daily tasks. Thank you for this most interesting presentation. It is very interesting because you reminded us of the fundamentals, the basis, and the standards that we need to comply with. And this is something that we need to be reminded of. And with PCAT and the Institute, you saw that there are ways to be supported in order to implement those quality processes. We will now move to the last presentation, and it will be about the issue of women and the possibility to support women who are faced with substance use. And I will give the floor to Hendree Jones, who I believe is online as well.
Yes, thank you.
Who will give us the last presentation.
Thank you so much for this beautiful opportunity to
Merci beaucoup
present
pour cette
to this wonderful group. My name is Dr. Hendree Jones. I am a professor in the Department of Obstetrics and Gynecology at the University of North Carolina in Chapel Hill in the United States. I also wear many hats and have had the joy and the privilege of working with the UN, with the WHO, with the Colombo Plan, and with CCAD. And we have been working to improve the world for women who experience substance use disorders. And through this collective work, we have created the Global Women's Network for providers of women's substance use disorder treatment and recovery. We're often asked, why would you need a special group for providers of women who are serving those women who have substance use disorders? And as you can see from this slide from the UNODC, throughout the world, no matter which country or community you look at, women are underrepresented and ignored in treatment. Not only are they ignored, they are often more stigmatized and discriminated against. And that means that while we have, for example, with amphetamines, 45% of patients reporting women who are in past year substance use, only 18% of them are represented in treatment. In fact, across the world, oftentimes women might represent only 5% of those in treatment, and at best, 30%. And when we talk to providers of those who serve women who have substance use disorders, what we hear is that they feel stigmatized, they feel alone, they feel isolated, and they don't necessarily know what the best practices are that they can do to help women who have unique needs in treatment. We know that there are gender differences in terms of why females or women initiate substance use. We know that there are differences between men and women in the biological effects of substance use disorders on our mental health as well as our physical health. And we know that for women to succeed in treatment, that they need specialized responses to treatment. For example, things like access to childcare, being able to respond to their trauma, their sexual, physical, and emotional abuse. And those are only a few examples. We also know that women are unique in the way that they recover from their substance use disorder. And so with collective feedback and with feedback that we have gained from our specialized 4-course called WISE, which is the way that we have provided interventions and training providers around the world in many different countries, in Latin America, South America, Asia, Africa, to name a few continents and countries, that we have created this very unique global network to help support the workforce, to build up the workforce of women's treatment. So this network is providing a nurturing, an empowering, and an educational platform to make the treatment workforce not feel so isolated and alone, and to improve access to treatment and to improve outcomes for those women who are in substance use disorder treatment. What does the Global Women's Network provide? Right now, we have not officially launched this network. We will do that in June in the Art of Healing conference that will happen in Greece. In preparation for that global launch, we have been hosting digital events, which one of our individuals who attended from Pakistan said, really, these monthly events should be called practical knowledge programs. I gain so much information from these programs, and they're unique in the stance that we provide the top 5 tips. Like in January, we provided the top 5 tips on self-care for providers as well as for patients. And once we provide those tips, then people from all over the world have an opportunity to then talk and share experiences. And that's where the magic of this virtual community comes in. People have the chance to exchange knowledge and ideas and to feel supported in what they do. We will be launching mentoring meetings. So taking the best knowledge and wisdom that is out there for women's treatment and pairing more senior professionals with those who are newer in the field to help support and build and create community and expand access to treatment and improve outcomes. We will also be continuing our skills-based training. You know, CCAT has been doing this, UNODC has been doing this, Colombo Plan has been also sharing our WISE courses, that's specialized women's treatment intervention courses. And then, of course, we will have news that you can use, communication with newsletters and other practical tools and skills. So to give the provider who has that woman in front of them, what do you do? What do you say? How do you help provide that individual woman with the skills and the tools that she needs to not only enter treatment, but to complete treatment and to enter and sustain recovery? And sort of the centerpiece of this global women's network is going to be a personalized treatment program that is evidence-based technical assistance. So taking all of the best resources that are out there internationally, nationally, publicly available, and helping each program that is interested in improving their access for treatment for women and improving the processes of how they are responding to women and women's treatment outcomes on the individual level and the program level. And we've designed it to account for 3 common categories of treatment programs that are out in the world. There are programs that have never treated women in substance use disorder facilities, but they're interested. What do? We know that we don't want to treat women just like we treat men. So how do we help? We have toolkits and assessments and a structured approach for that type of treatment program. Most treatment programs are going to treat women in a mixed gender setting. So again, we have tailored responses for how to help that each individual program improve their processes and outcomes for women in a mixed gender setting. And finally, there are several programs or many programs out there that treat women in a women-only setting. And oftentimes they want to improve their outcomes and their processes. What can we do to be on the cutting edge of evidence-based care? So we will have a tailored response. So if you're interested in joining us, I will share my email at the end. But before I end, I wanted to provide some thoughts that providers of treatment have shared with us. The fact that they do feel isolated and lonely, and they're so excited about this network to overcome that isolation. They want to help women access treatment by increasing information and treatment spaces that women feel physically safe and psychologically safe to heal and recover. They have asked for ways to achieve gender and cultural awareness among staff, as well as among the patients and clients. They want help addressing gender violence and stigma that happens for women. And finally, creating those sacred spaces for women to heal. I oftentimes talk to women before I give presentations about women's treatment. And these are some common thoughts that women in treatment have shared. Please do not judge us. There isn't anything else that you could tell us that we haven't already said to ourselves. Please don't shame us anymore. If shame worked, we wouldn't have a substance use disorder problem. please give us that empathy and practical tools and support. Please also let us be an active part of treatment. Treatment should not be something that is done to us, but that we have a shared decision-making power to guide our course. Please help us be the best parents. Don't just tell us what to do, but show us how to be the best parent that we can be. And finally, when you are considering residential treatment, please don't have us make the gut-wrenching decision of going to treatment and getting well while we leave our children perhaps in unsafe circumstances. Please let our children come with us to treatment. And I'd like to acknowledge the wonderful expert advisory committee we have that is represented by all of the IOs and INL with their support. And there is my email there if you are interested in joining our practical knowledge events and learning more about the Global Women's Network. I would be delighted to receive an email from you. And the very last piece, and this is because we are a very collaborative network, I wanted to put a plug in for the Global Recovery Network, which is going to also be launching in June of 24, which has a whole research agenda, policies for organizational infrastructure, sets of services to really work on building and reinforcing recovery as a lifelong learning, to forge those connections and helping expand recovery throughout the world. And there is the QR code that I will leave for you to take a picture of. And thank you so much for your time and attention.